Welcome back. Today I'm going to be talking about abdominal regions. So, regions of the abdomen are theoretical divisions that we clinicians use to help localize, to help identify, and to help diagnose patients' symptoms. So there are two categories of this. There's going to be the quadrants, and then the other part would be the regions, or some might like to call that the segments. So when we're talking about the quadrants, think of four. When you see this line, where you see a line dividing the abdomen and the pelvic area into four sections, then you know that we're going to be talking about the abdominal pelvic quadrants. So the first one's going to be the right upper quadrant. Opposite of that would be the left upper quadrant, and below the right upper quadrant would be the right lower quadrant, and then next to it would be the left lower quadrant. And the feature here is that they intersect at the navel. So we're going to be talking about the regions now, otherwise known as the segments. They are a little bit more precise, more compact than the quadrants, because there are going to be 9 of them, 9 regions or 9 segments. We see here the right hypochondriac region, and right next to it would be the epigastric region, and then right next to that would be the left hypochondriac region. So when you're talking about the epigastric, we're thinking has to do with gastric, which is the stomach. All right, so that should give you a clue right there. And then the right lumbar region, the bones of your lower back are the lumbar vertebrae, so that's where that word comes from. So there's going to be the right lumbar region, and right next to it in the middle between the right and left lumbar will be the umbilical region, where your navel is located. All right, and on the far left will be the left lumbar region. And below that will be the right inguinal region, which will be the groin area. We talked about this. Another word for the inguinal will be groin. And right next to it will be hypogastric, also known as the pubic region. So think of the gastric again, which means the stomach. And when you hear the word hypo, below the stomach, obviously not exactly below the stomach, but this will definitely let you know that this is not going to be right by where the stomach is located. And right next to it would be the left inguinal region. So on this slide, we're going to now see the organs are located in the segments, in the regions, and the quadrants. So first I'm going to be talking about the organs located in the quadrants. So the quadrants are going to be the blue line, while the regions will be the red lines. All right. So in the quadrants, we can see that it's a little bit bigger. We're going to see in the right upper quadrant, the liver is going to be located. The gallbladder is sticking out here. We see the end of the liver also, right? And then we're going to see part of the stomach, and then a whole bunch of the intestines, the large and the small intestine. And then when we get to the left upper quadrant, we see the big portion of the stomach and the spleen and the rest of the large and small intestine. And when we get to the right lower quadrant, we're going to see the rest of the intestines, but especially here, we're going to see the appendix, which is so tiny, so small, you can barely see it. And then we also see part of the bladder, and when we move on to the left lower quadrant, we're going to see the rest of the intestines and the bladder. Now, zoning in into the regions. So in the right hypochondriac region, we see the liver, we see the rest of the liver in the epigastric region, and we also see the stomach, which we expect to see because that's the epigastric region, right? In the left hypochondriac region, we're going to see the spleen there also. And in the right lumbar region, with the umbilical region and the left lumbar region, that will all be mostly the large intestine. We're going to see that that's where the large intestine can be found. So that the patients will present with colon problems. So another word for large intestine is colon. And then when we get to the right inguinal region, we're going to see just a little bit, almost nothing there, but still a little bit of the intestine. But then when we get to the pubic region or the hypogastric region, we're going to see the bladder, and we're going to see the rest of the small intestine and the appendix again. And then when we get to the left inguinal region, we're going to see the rest of the intestines. So the reason why these are theoretical divisions, it helps clinicians to narrow, to zone in exactly what is wrong. You know, when a patient comes in and talks about having abdominal pain, you know, there's so many things located in the abdomen. How do you know what is wrong? What organ should we be looking at? And so on. So that concludes the end of today's review. Thank you. Bye.